Imagine walking into a store where the price tags are blank. You need what they're selling, but you have no idea how much it costs or what's included. That's what health insurance feels like for millions of Americans. Confusing, overwhelming, and sometimes scary. But here's the secret. The health insurance marketplace was designed to make this confusing world at least a little simpler. And today, I'm going to break it all down for you in plain English. By the end of this video, you'll not only know how the marketplace works, but you'll also discover a little-known detail that could save you hundreds of dollars a month. Stick around because you don't want to miss that. Number 1. What is the health insurance marketplace? The health insurance marketplace is like an online shopping mall, but instead of shoes or gadgets, you're shopping for health insurance plans. It was created under the Affordable Care Act to give people a central place to compare coverage options, check prices, and see if they qualify for financial help. Think of it like Expedia, but instead of flights and hotels, you're comparing health plans side by side. For example, if you live in Texas and don't have job-based coverage, you can log in and see every plan available in your area, all organized neatly in one place. Number 2. Who can use it? Not everyone needs the marketplace. If you already get insurance through your employer, Medicare, or Medicaid, you usually don't need it. The marketplace is mostly for people who don't have those options. That includes freelancers, small business owners, part-time workers, or anyone whose job doesn't provide coverage. For instance, if you're driving for Uber or running your own Etsy shop, the marketplace is likely where you'll go for health coverage. Number 3. How does it work? Here's the step-by-step. First, you create an account on healthcare.gov or your state's marketplace site. Next, you fill out an application with basic info like your household size, income, and where you live. Based on that, the marketplace shows you what plans you qualify for and whether you're eligible for discounts. Then you can compare plans, looking at monthly premiums, deductibles, and doctor networks, and pick the one that fits your needs. Imagine it like a dating app. You set your preferences, and the marketplace shows you your matches. But instead of a date, it's a health plan that hopefully won't break your wallet. Number 4. What are subsidies and how do they work? This is the part most people don't understand, and it's where the real money saving happens. Subsidies are discounts the government gives to lower your monthly premiums and sometimes your out-of-pocket costs. They're based on your income and family size. For example, if you make $40,000 a year, the government may cover a chunk of your monthly premium, turning a $500 plan into maybe $150. That's huge. The marketplace calculates all this for you, so you don't have to do the math. And here's the curiosity loop I promised. Most people don't realize that even middle-income families can qualify for these savings. We'll get to that secret soon. Number 5. The different types of plans explained. Marketplace plans are grouped into metal tiers: bronze, silver, gold, and platinum. But don't let the shiny names fool you. Bronze means lower monthly premiums but higher out-of-pocket costs. Silver is the middle ground and often the most popular. Gold and platinum have higher premiums but much lower costs when you actually go to the doctor. Here's an example. Imagine two friends. Sarah picks a bronze plan with a $200 monthly premium, but every time she goes to the doctor, she pays more out of pocket. Jake chooses a gold plan with a $400 premium, but when he lands in the hospital, his costs are way lower. The right choice depends on how often you expect to use healthcare. Number 6. Open enrollment and deadlines you must know. The marketplace isn't like Amazon where you can shop anytime. It has strict deadlines. The main time to sign up is during open enrollment, usually between November and January. Miss it, and you'll need to wait until next year unless you qualify for a special enrollment period. That happens if you have a major life change like losing your job, getting married, or having a baby. For example, if you leave a full-time job in June, you don't have to wait until November. You qualify for a special enrollment. Right then. Number 7. What's the difference between marketplace and private insurance? You might wonder, can't I just go directly to an insurance company? Yes, you can. But the key difference is subsidies. If you buy directly from an insurer outside the marketplace, you won't get government discounts. So while the same plan might be available both on and off the marketplace, only the marketplace plan may come with financial help. That's like buying concert tickets. Sure, you can buy from the official box office or a reseller, but the official box office might give you a big discount if you qualify. Number 8. Networks and coverage. Don't get caught off guard. One of the biggest mistakes beginners make is ignoring the provider network. Just because a plan looks cheap doesn't mean it covers your doctor or hospital. Marketplace plans have different networks, HMO, PPO, and so on. If your favorite doctor isn't in the plan's network, you may pay full price to see them. For example, imagine buying the cheapest plan, only to find out your local hospital isn't covered. Suddenly, that affordable plan feels very expensive. Always check the network before you click enroll. Number 9. Out-of-pocket. Costs explained simply. Here's where insurance gets confusing. Premiums are what you pay every month. Deductibles are what you pay before insurance kicks in. Copays are small amounts for doctor visits. Coinsurance is your share of costs after the deductible. Out-of-pocket maximum is the most you'll pay in a year. After that, insurance covers everything. Example time. Let's say your deductible is $2,000 and you break your leg. You'll pay up to $2,000 before insurance starts pitching in. Once you hit your out-of-pocket max, maybe $8,000, the insurance pays 100% of the rest for that year. Number 10. Income levels, and that little-known detail you need to hear. Remember I said there's a secret that could save you hundreds? Here it is. Many people think subsidies are only for very low-income families. But in reality, under current rules, families making well above the poverty line, sometimes up to 400% of it, can still get financial help. That means even if you earn $70,000 or more as a family, you might still qualify for subsidies. Imagine you're earning a decent paycheck, but healthcare is eating up your budget. The marketplace could shrink your premium from $800 a month down to $300. And many Americans never even check because they assume they won't qualify. That's money left on the table. Number 11. Extra savings with silver plans. Here's another tip most people overlook. If your income qualifies and you choose a silver plan, you may get something called cost-sharing reductions. That lowers your deductibles, copays, and coinsurance. For example, instead of paying a $40 copay at the doctor, it might drop to $15. Instead of a $4,000 deductible, it might shrink to $1,000. But this only applies if you choose silver. Pick bronze or gold, and you miss out. Number 12. Common mistakes to avoid. One common mistake is focusing only on monthly premiums and ignoring total costs. Another is not checking the provider network. Some people also forget to update their income if it changes, which can cause problems at tax time. For example, if you guess your income too low, you might have to pay back some of your subsidy when you file taxes. But if you guess too high, you could be missing out on savings all year. Always keep your marketplace account updated. Number 13. Why this matters more than you think. Healthcare is not just about doctor visits. It's about financial protection. Medical debt is one of the top reasons people in the USA go bankrupt. Having a marketplace plan can be the difference between a $50 urgent care visit and a $5,000 emergency room bill. Even if you're young and healthy, one accident could wipe out your savings. For example, a broken arm can cost $2,500 without insurance. With insurance, you might only pay $300. Number 14. How to get started today. The first step is simple. Go to healthcare.gov or your state's marketplace site. Create an account. Fill in your household info. See your options. Compare carefully. Look at premiums, deductibles, networks, and the total costs. And always check if you qualify for subsidies. Remember, the marketplace was built to give you options and help you save money. You don't need to be an expert. You just need to take the first step. Number 15. State versus federal marketplace. What's the difference? Not every state uses the same marketplace website. Some states run their own, while others use the federal site healthcare.gov. For example, California has Covered California, New York has New York State of Health, and Kentucky has Kinect. If your state has its own system, you'll apply through that site instead of healthcare.gov. The rules are mostly the same, but the websites may look different and have slightly different deadlines. Number 16. Can you keep your marketplace plan if your job offers insurance? Yes, but with a catch. If your employer offers health coverage that is considered affordable and meets minimum standards, you usually won't qualify for marketplace subsidies. That means you could buy a marketplace plan, but you'd pay full price. For example, if your company plan costs $120 a month and covers the basics, the government expects you to take that plan. But if your job's plan costs half your paycheck, you may qualify for marketplace help instead. Number 17. What happens if your income changes during the year? Life is unpredictable. You might pick up a side hustle, lose a job, or get a raise. When your income changes, it can affect your subsidies. If you make more than you estimated, you may owe back some money at tax time. If you make less, you may qualify for bigger subsidies right away. For example, if you expected to earn $50,000 but only made $30,000, updating your marketplace account mid-year could lower your premiums immediately instead of waiting for tax season. Number 18. Can you cancel a marketplace plan anytime? Yes, you can cancel whenever you want. But be careful. If you cancel without other coverage lined up, you might be stuck uninsured until the next open enrollment. For example, let's say you cancel in March because you get a new job with health benefits. That's fine. But if you cancel in March just to save money, you could be uninsured until November unless you qualify for a special enrollment period. Number 19. What about dental and vision coverage? The marketplace doesn't just offer medical insurance. You can also shop for dental and vision plans. Sometimes they're bundled with your health plan, and sometimes you buy them separately. For example, you might pick a silver health plan for your medical coverage and add a standalone dental plan for about $30 a month. This is especially helpful for families with kids who need regular dental checkups. Number 20. What if you already have Medicaid or CHIP? If you qualify for Medicaid or the Children's Health Insurance Program, you usually won't need a marketplace plan. The marketplace will even check your eligibility for those programs when you apply. For example, a family of four earning $35,000 a year might discover through the marketplace that their kids qualify for CHIP, which could mean little to no cost for their children's coverage. Number 21. What documents do you need to apply? Applying is easier if you have your documents ready. You'll need your Social Security number, proof of income like pay stubs or tax returns, and details about your household. If you're not a citizen but a legal resident, you'll need immigration documents. For example, if you're a single mom applying for you and your two kids, you'll need your Social Security card, your kids' info, and last year's tax return. Having it all on hand saves time and stress. Number 22. What happens if you move to a new state? Moving counts as a qualifying life event. That means you can switch or update your marketplace plan outside of open enrollment. For example, if you live in Florida and move to Ohio for a new job, your Florida plan won't cover Ohio doctors. The good news is, the move opens a special enrollment period so you can pick a new plan in your new state. Number 23. Do marketplace plans cover pre-existing conditions? Yes. One of the biggest protections of the Affordable Care Act is that insurance companies cannot deny you coverage or charge you more because of pre-existing conditions. Whether it's asthma, diabetes, or even cancer, you're guaranteed coverage. For example, if you had cancer 5 years ago, a marketplace plan must cover you the same way it would cover someone who never had cancer. Number 24. Do you need to file taxes to qualify for subsidies? Yes. If you want the government to help pay for your premiums, you must file a federal tax return. That's because subsidies are actually tax credits. At the end of the year, the IRS checks your income against what you reported on your marketplace application. For example, if you said you'd make $40,000 but actually made $35,000, you could get extra credit back when you file. Number 25. Do marketplace plans cover mental health and maternity? Yes, every marketplace plan must cover essential health benefits, which include mental health services, prescription drugs, maternity and newborn care, preventive care, and more. That means therapy sessions, prenatal visits, and baby delivery are all part of the package. For example, if you're planning to have a child, a marketplace plan ensures your prenatal checkups and hospital delivery are covered. Health insurance might seem like a maze, but the health insurance marketplace gives you a map. Now you know how it works, who it's for, and most importantly, how it could save you thousands of dollars a year. The big question is, if you've used the marketplace before, what was your experience like? And if you haven't, what's stopping you from checking your options today?